Joining us now to talk more about the busy week in coronavirus news is Dr. Ali Hassoun, infectious disease specialist at Huntsville Hospital. Thanks for being here.
Thank you for having me.
Huge news right off the bat this week about Pfizer's coronavirus vaccine. That was followed closely by news of Eli Lilly's antibody treatment getting emergency FDA approval. I know as a scientist you tend to be slow to excitement about these kind of announcements, but I got to believe even you had to find these developments encouraging.
It's definitely exciting, Dan, to hear these. We've been waiting for a long time to hear some good news about the vaccine. It's definitely encouraging, but I agree with you as well. As a scientist, we really want to see more data to have confirmation of the safety and efficacy. The initial press release is very, very encouraging, and I hope they're going to release more information. So as the vaccine will be available, everybody will be happy to take it and ready to take it at the same time.
Yeah.
The same goes for the monoclonal antibody. This is very, very good news. We need in the community some kind of treatment.
Now to the bad news. Of course, there is no denying we are seeing a troubling spike in COVID cases. Madison County is on track to see 2,400 new cases just this month. Yeah. One county, more hospitalizations, more deaths. What is going on? Why are we seeing this kind of a spike? And what can we do about it?
Yeah, I can tell you it is extremely concerning for us because we've seen significant rise in there. I think what's happening, there's several factors coming into this. One is the people getting, in a way, COVID fatigue. You don't want to follow the rules. On the other hand, there's been more gathering and more exposure. So there's more virus exposure. And the higher virus, I call it the community viral load, meaning there's more virus shedding around and there's higher exposure, there's higher chance of infection. And unfortunately, this is going to go and continue to increase unless people remember to follow, again, all these basic prevention. It really works, but we need to follow it and advise others to do it. Otherwise, we're going to see significant rise in pressure in the hospital, everywhere else. It's going to be major, major problems.
Certainly not going to be easy with the holidays coming up. So many schools are closing again because of not just positive tests, but quarantining of close contacts. I know you're not one of those I told you so kind of guys, but you did warn that this was a possibility. Nobody obviously wants to see a shutdown, but should schools take the example of Marshall County schools and just go virtual until January?
Yeah, I think at the moment with these numbers going up significantly, unfortunately, probably that's the only solution at the moment. I know the kids doesn't get infected as much the adult and they don't have much symptoms. It might be milder disease, but at the same time, I think, and I've seen it now over the last several weeks, it's the grandparents, parents, teachers, employee, all these are getting infected, and probably part of it is exposure from the kids going to school or going to sports. It is significant, and this, again, important to stop the transmission. And one of the way would be, unfortunately, is going to virtual at least 4 to 6 weeks. Yeah. Cut it down as much as we can, and then reopen, slowly. We're going to need to do something about that.
Dr. Ali Hassoun, thanks for being here tonight. Always appreciate your insight.
Thank you so much.